we have our supplies here. We have some cotton padding, some brown gauze, some white tape for our stirrups, some vet wrap, a popsicle stick to keep our tape from sticking together, and if we had a wound, we have some non-stick Telfa pad that we could put on there. So first thing we're going to do is go over our positioning. So we have our patient in lateral recumbency. We have our assistant holding both down limbs and putting pressure over the neck and the flank to keep the patient in position. We have, say we had a wound here, we would clip the area around the wound and clean it, and then apply our non-stick pad to the area before we put on our cotton padding. We wouldn't tape our Telfa on, we would just hold it in place as we wrapped our cotton around. Okay, so we're going to start here with using our white tape to put some stirrups on. Good boy. So we're going to rip two pieces that are about 6 inches in length, and these are going to go either on the medial and the lateral aspects of the foot, or they go on the cranial and caudal portions of the foot. We're going to put these on the cranial and caudal portions. So we're going to apply our stirrup, leaving a tail of about 5 inches or so, and put our tongue depressor here. And then we're going to put our other stirrup on this side. And stick it to our tongue depressor over here, like this. Now we're going to take our cotton wrap, starting around the toes, and we're going to wrap it up the limb past the elbow. We want to stretch it out when we lay it down, but not to the fullest extent so it doesn't compress on the leg. So we're going to stretch it about 50% of its stretch and wrap it around. And then overlay with the layer underneath about 50% as well. And we're just going to continue up the limb here. And we want to make sure that we don't have a lot of wrinkles or folds as we go along. And we're continuing to stretch our cotton about 50% of its stretch and cover about 50% of the layer below it. Go up to the elbow here. All right, so now that we're past the elbow, we're going to get a second layer going on here. So we're going to come back down, following the same rules, putting about a 50% stretch on it and covering our layer below by about 50%. We don't have quite enough for our full second layer, so we're going to use another roll here and just continue on. All right. Now we're just going to check and make sure that this layer isn't too tight before we continue on. So there's some spacing up here, and there is some spacing down here. And none of the areas does it look like the padding is pulled tight enough that it's restricting any of the other layers of the padding. So we're gonna go ahead and put on our brown gauze. And we're gonna have just a little bit of our cast padding poking out at the bottom and at the top here. So we're going to, this is kind of our compression layer, so we're gonna pull this to compress the cotton padding below, and just as before, we're going to overlap with our underlayer about 50%. We want it to be tight enough to compress our cotton layer, but not too tight as to restrict any blood flow. Okay, so we have our gauze layer here. We have a little bit of cast padding on the top and cast padding on the bottom. We can check our tightness by checking underneath all of our layers, and we still have some mobility on both edges here, and we don't have any places along our leg that look like that is significantly compressed compared to the rest of it. So now we're going to take our stirrups and we're going to reverse the direction of our tape and lay it over our gauze. Like that. And that'll help keep everything from sliding. Now we're going to take our last layer, our vet wrap, and starting at the distal portion, we're going to do this again. So we want to make sure there's a little bit of cast padding sticking out down here. And we're going to overlap about halfway, and we're going to stretch about 50% of our stretch here on our vet wrap. We're going to go up past the elbow with this one as well. Like that. And then we're going to check our tightness once more. Checking under all the layers, we have a little bit of mobility on both the above the elbow and the toes, so it's not compressing these parts of the limb too much here. And you can look down the limb, and no parts of our bandage are significantly more compressed than the other pieces. And we can also check our toes down here. If we're compressing too far, our toes will begin to get cold, and they will be discolored. So we just want to make sure that our toes are not discolored and that they have a good normal temperature to them. And that's how we do a Robert Jones modified bandage.